Hey, folks. How you doing? Dave Noriega along with Debbie Dujanovic. We just wrapped up our show about an hour and a half ago, but there was still something left on the table we want to talk about. I want you to feel free to chime in on the conversation, and it has to do with vaccines.
Question we asked during the David Dujanovic show. We went a full hour on this. In fact, it's so important. The discussion was just so insightful. Who should get the vaccine second? We already know that healthcare workers are first in line in Utah and across the country, especially those who work closely with COVID-19 patients. But Dave, we put together a list of, question marks. Who should get the vaccine second? Should it be police officers? Should it be teachers? Should it be the 65 and plus crowd?
Yeah, and initially, Deb, when we heard the plan, and this has been a plan not just in Utah, but across the country, that the number one person or persons or group, however you want to couch it, excuse me, who's going to receive it first is healthcare, right? Healthcare workers. And initially I was like totally fine with that. And I'm like, oh, that makes sense because they're the ones that are most often exposed. But then I started thinking about it a little bit more. And I started thinking, well, exposure doesn't necessarily mean danger, right? Because we have seen over the last 9-10 months really who is affected the most. And it isn't necessarily healthcare workers. It is an age demographic. It's the 65 and older crew. So my question was, and this is what kind of bothers me a little bit, why all of a sudden are we prioritizing jobs instead of the most vulnerable? And we went on this little fact finding or a search and we started discussing it with various groups, with police, with teachers, and with the elderly, with advocates of those groups. And I think, Deb, I'm even more confused of why we have the vaccine rollout the way we do.
Yeah, and the way we have it right now, let me just read it off. And again, we want, leave us your comments here on Facebook, on our Facebook Live for the next few minutes, and we'll bounce those comments off you and off each other. Healthcare workers are first, according to the state's current plan. Then comes first responders sometime in January, and also long-term care residents. But then come March and July, you've got teachers and the 65 plus crowd. So our question first, we had the Fraternal Order of Police call in. The president, Brent Jex, called in because we wanted to have each different group make their pitch for getting the vaccine, second, right after healthcare workers. So here's what the Fraternal Order of Police said, which surprised us.
I don't think that this is a time for everybody to push to the front of the line to make sure that I get the vaccine or that my life is more important than somebody else's. I think we have to look at it as who's the most vulnerable and get it to them and in that population.
And I can't say I'm totally surprised to hear that from the police union because cops, the inherent nature of the job is I'm going to put myself at danger before I put somebody else at danger. But I think, again, he's touching on what I'm concerned about. Why would a 25-year-old super healthy police officer receive a vaccine before my 75-year-old mother? Now, I'm not just advocating for my mother. I'm advocating for all grandmothers and all grandfathers because we see and we know that the data is very, very clear. If you are 65 and older, you make up the vast majority of hospitalizations and deaths.
Well, when we talked to the FOP, Fraternal Order of Police, they touched on a good point, which is perhaps that not all police officers should be second in line, but what about patrol officers? For example, as I pulled the national data to look at police officer deaths from this year, 154 officers of the 263 officers who have been designated as killed in the line of duty. In other words, they have a line of duty related death. 154 of them have been killed as a result of contracting COVID on the job. So we know police officers are first in many instances, and the situations are dynamic. But that was the discussion that we had with the Fraternal Order of Police. They weren't exactly on the line to with us to pitch, knocking other people out of the way to get to the first in line. It seemed like they were telling, they're saying, hey, we're going to the back of the line while the rest of you
Kick us back.
vaccinated.
Yeah.
Josh Blake posted on Facebook, on our Facebook Live here, said the general public. Josh, the general public will be getting it sometime around July, according to the state's plan. But I'm curious if you follow up with your reply there on Facebook to see, why are you pitching the general public before 65 and plus community? Dave, who else do we talk to on the show today? Remind me, teachers
Heidi
union
Matthews from the UEA, the teachers union. She wanted to make a pitch that teachers are part of these essential workers, and if we want to return, the kids to the classrooms, then we really need to protect the teachers first. Let's hear from Heidi Matthews.
You're hitting the nail on the head why it should be prioritized, so that we are able to maintain as much going into or finishing as strong as we can with this school year, and getting as much student learning in as we can with a more protected workforce in our schools. So I think that timing is really essential for again, student learning, social, emotional well-being, and having that option for our.
And Debbie, I think she was touching on a concern that you had, that when teachers get the vaccine in March, that's kind of when they're slated, March, April, March through July, that if they go that late into the school year, then basically the school year is going to be over by the time they receive their vaccines.
Right. And the point I was making, you're absolutely right, was this is a 2-dose vaccination. You get your first dose with Pfizer, for example. 3 weeks later, you go get your second dose. So let's say a teacher goes in mid-March. Well, they're not getting their second dose until second week of April. And then how long does it take effect, full effect? Well, we may be into May, Dave. And so my point was, schools are generally out for the summer. Do teachers need to be bumped that far up the line? Let me tell you, not that I do, of course, feel that teachers are so valuable, but just in terms of timeline, I just felt a little bit like we're going to go into the summer and we're still going to be vaccinating teachers with their second dose. Does that make sense?
Right. Which really helps them out come the next school year, we think, but we don't know how long vaccine works. We don't know if this is a 3-month fix. We don't know if it's a 6-month, a year, or a lifetime fix for COVID. So that's one of the key ingredients to this. We just have no idea. We don't know how long the vaccine is going to be effective.
Now, the group you seem to be advocating for on the show was, let's push the 65 and over community to the front of the line. We had an ICU nurse, Trevor Zazula. He called in live to advocate for that age group. Let's hear from him.
Mortality rates. If we're looking at mortality rates, which is ultimately not the acceptable number at all, but the average age is 74. Basically, almost 80% of anybody who enters the hospital that is in the age group of 64 or higher has an 80% mortality. How is that acceptable on any means?
And that's what really concerns me. And we see this. If you go to the website, if you go to the state website, coronavirus.utah.org, ed.com, it's one of those.
Yes, .org. Right.
It just automatically pops up as soon as I type in coronavirus, and then I hit enter. But the numbers are very obvious. They're right in your face. You'll see which age group is hospitalized most and what the average mortality is, and it's 75 years old. That's who's dying right now. So if we focus the vaccine on this 65 and older crew, the people that have underlying conditions that are most vulnerable because of their health, that is going to include teachers and first responders and everybody that is at risk. And the state of Utah, I think, has missed the boat on this. I think they're focusing so much on exposure instead of vulnerability. And that is a big mistake in my opinion, because again, if we're talking about the 25-year-old healthy police officer, first responder, and a grandma that has had a heart condition or a grandpa that's had a heart attack, that's the person that needs the vaccine, not the healthy first responder.
There's my dog. Apparently there's
think
an
that's your
Amazon
dog.
delivery. I'm sorry. Let's put up with Riley for a moment here. This happens about once a
Really
day
zip
now.
it.
Oh, yeah.
Hey,
I wanted to point out real quick. Go ahead.
Okay. Oh, I was just going to say, I have 2 minutes. Lee Lonsbury's show is on right now, and I'm going to join Lee in just a minute to have this conversation, to dive into it.
So you're going to go on Lee's show, and let me just leave you with this thought then, Dave, as we say our goodbyes to our Facebook friends here. And that is with the way that the vaccine is being rolled out, we know that the FDA is set for an emergency approval meeting for Pfizer's vaccine next Thursday. We could have healthcare workers in Utah being vaccinated with the first inoculation as early as Friday of next week, which is amazing. Then we got Moderna, which has a December 17th date with the FDA for its first emergency approval meeting. I think that this is going to start, if everything gets approved. Okay, that's a big if, I know that. I think the ball's really going to start rolling on this. We may not even have to have this conversation in a couple of months, because my feeling is there are going to be hundreds of thousands, if not millions of doses available across the country per state, that we're going to just start inoculating people, but for left and right, whoever wants it. But for right now, when we know the first of 100,000 doses are coming to Utah, or the first doses, which will be a wave of 100,000 doses, are coming to Utah in the next couple of weeks. This is why the state had to lay out a plan. I don't know, like with everything with COVID, if this plan will still need to be in place in a few months from now, when more and more of these vaccines start showing up.
Yeah, hopefully it's a moot point that we have more vaccines, that we know what to do with. I hope that's the case. And again, this is Moderna, this is Pfizer. We haven't even seen Johnson & Johnson. They have a very promising vaccine coming up. So who knows? By March, we may have everybody vaccinated. Hopefully that's the problem that we're dealing with, is trying to get it to everybody, because we have so many doses. Anyway, hey, thanks for joining us on Facebook Live.
I'll tune into Lee's show.
We'll see you guys later.
And we'll be back tomorrow at 9 a.m. on KSL News Radio 102.7 FM. You can always tell Alexa to play KSL News Radio. It's the David Dujanovic Show, 9 to 11 a.m. Monday through Thursday. See you guys.
See ya.